Good afternoon, everyone. My name is Maura Healy, Massachusetts Attorney General. Thank you all for being here today. I am so pleased to be joined today by so many terrific colleagues, including Senate President Stan Rosenberg, District Attorney Michael Morrissey, Senator John Keenan, Senator Eric Lesser, Secretary of Health and Human Services Mary Lou Sutters, Department of Public Health Commissioner Monica Burrell, Plymouth Fire Chief Ed Bradley, Norwood Police Chief Bill Brooks, who also represents the Massachusetts Chiefs of Police Association, Chief Rick DeLore, President of the Fire Chiefs Association of Massachusetts, Police and Fire from Boston, Weymouth, Quincy, Chelsea, and Gloucester, Suffolk County Sheriff Steve Tompkins, and Jack Beckwith from the Massachusetts Municipal Association. I also want to thank Eric Gold, Assistant Attorney General in the Attorney General's Office Healthcare Division, who helped make possible the tremendous agreement we are going to announce today. I want to especially thank Jean Flynn and Melissa Wixner, who lost their children to battles with heroin addiction. I want to thank you, Melissa and Jean, for your willingness to be here today to put a face on addiction and this epidemic and to share your stories. Today, however, is about saving lives. Today is about our state taking action to help communities fight the heroin epidemic. Last year alone, heroin and opioids claimed the lives of over 1,200 people across this state, an average of 4 people a day. What's even more shocking, though, are the countless number of overdoses that didn't result in death, but yet had a devastating impact and continue to have impact on families and communities across this state. These are people's mothers, fathers, sisters, and brothers and children, all of whom have struggled with what we know is a profound and devastating disease. Because for every fatal overdose in the state, we know there have been countless more overdoses. We know that many of those overdoses have not resulted in fatalities because of a life-saving medication called Narcan. In Worcester, for example, last year alone, since August, the use of Narcan by police and fire has saved over 129 lives. And that's the same for communities across this state. We know this drug is important. We know it saves lives by reversing overdoses in an instant and bringing those people back from the brink of death. Recent data from Quincy, for example, which is the first city in the country to require every officer on patrol to use Narcan, showed that first responders were able to save lives with Narcan 95% of the time. And we're grateful to have with us here today Lieutenant Detective Patrick Glynn, who oversees the Quincy Narcan program. That is why it is so important that we get Narcan in the hands of first responders, in the hands of those who are on the front lines of today's epidemic, and that is what today is all about. Earlier this year, we learned and we listened to stories about the rapidly increasing price of Narcan across communities. At a time when the need for Narcan was growing, the price of Narcan was growing, exponentially in fact, doubling sometimes in price from even in the course of a couple of weeks for police and fire departments and municipalities across this state. We heard from our first responders, we listened to cities and towns, and today we're showing how we took action. Because we never want cost to be a roadblock in saving lives and helping people here in this state. Our office reached out to the maker of Narcan, Amphastar Pharmaceuticals, and after review and hard work by the team in this office, together with partners on this stage today, I am so proud and pleased to be able to announce today's first-in-the-nation agreement. Today's agreement is going to help establish a fund of nearly $500,000 that will, for the first time, make Narcan available to every city and town at a sharply reduced rate. Amphastar has agreed to pay us, the Commonwealth, $325,000, which will go into a fund, the newly created Municipal Naloxone Bulk Purchase Trust Fund. This fund will allow cities and towns to buy Narcan directly from the Department of Public Health and get the best possible price. That is a result of the hard work and leadership by Senate President Stan Rosenberg and by Senators Keenan and Lesser, and to their legislative colleagues who took the initiative a few weeks ago in establishing this new fund. Last year, we know first responders used about 11,000 doses of Narcan. This funding, today's funding, will allow us to make available the equivalent of 15,000 doses to every fire department and police department in the state that needs it at a sharply reduced rate. Again, I want to commend and thank Senate President Rosenberg and Senators Keenan and Lesser for their leadership on this issue, and for all who came together a few weeks ago through the budget process to make this possible. As I say, this fund and this agreement will result in us being able to make, as a state, Narcan more available to first responders and those who are on the front lines, with the ability to save lives and help communities here in this state. I want to thank in particular Secretary Sutters and Commissioner Burrell. The Department of Public Health and the Secretary of Health and Human Services have been tremendous, strong partners in this effort on any number of fronts to combat heroin and the opioid crisis. And they, through the Department of Public Health, will be administering this fund. I also want to thank District Attorney Mike Morrissey from Norfolk County for all of his help in bringing this issue to the forefront and working with our office on this issue. I've heard directly from local police officers and firefighters who have had to administer this life-saving drug, sometimes 2, 3 times, 4 times in one night alone. This agreement is going to help them, and it's going to help them help people and families across this state. It will improve access to Narcan, and as a result, save lives. I want to thank all of the first responders who are represented here on stage and who represent so many tremendously brave men and women who are on the front lines working day in and day out to help families in the midst of what we know is a terrible public health crisis and epidemic. But I believe that today's action is going to make a difference as we continue to push for better access to treatment, more education and outreach, particularly to young people, as we work in this office to take a hard look at the practices and the marketing by pharmaceutical companies. This is yet another piece of the puzzle. In the same way, last week's announcement about the creation of the trafficking crime of fentanyl is part of this. So we're going to continue to work hard out of this office to combat this disease, to work in partnership with others in government on this front. But I'm very pleased about today's agreement because, as I say, this represents an effort where we are going to make, in real time, more money available to supply a needed life-saving medication that's going to help save lives and help families here in this state. So thank you all for being here, and at this time, I'd like to turn the podium over to Secretary Sutters. It's been an honor for our office to work with Secretary Sutters and her team and Governor Baker and his working group on the heroin opioid epidemic. It has been a productive and terrific partnership. We will continue to bring to bear all the resources that we can on this issue. As you know, this has been a top priority for the Attorney General's office. I know it's been a top priority for the Baker administration, and I want to thank Secretary Sutters for all of her work and her leadership on this issue. Secretary Sutters.
Thank you. Thank you, Attorney General. It's going to take all of us together working to mitigate the opioid epidemic in the Commonwealth of Massachusetts. We've always said since the very beginning of the working group coming together, I want to thank the Attorney General for her leadership. I want to thank the Senate President, our friends in the legislature, because it takes the work of the executive branch, the legislature, and the Attorney General's office to really deal with what has become this catastrophic epidemic in the Commonwealth of Massachusetts. Honestly, if anyone had ever said to me 3 or 4 years ago that the path to heroin was opioid prescription drugs, I would have said, you know, there are lots of things that are very complicated when you think of healthcare and human services, but it's very clear that one of the pathways to heroin, one of the clear pathways, is through opioid medications. Narcan is a lifesaver. There's just nothing more basic than that. It allows our first responders to completely reverse a death, an opioid death, a heroin death, and to get someone to treatment. The commitment in the Baker administration since the release of the opioid working group is just to continue to work at this with our colleagues in the Attorney General's office and the legislature. I'm grateful for the tremendous, tremendous efforts of the Attorney General's office for this settlement that will obviously increase the availability of Narcan to our first responders. From the Secretary of Health and Human Services and the wonderful Department of Public Health, our commitment is the full public health approach to this epidemic, which is prevention, intervention, treatment, and recovery, and it's going to take us a long time to bend this trend. But Narcan, make no mistake about it, it's a lifesaver. And so I just want to really thank the Attorney General. I want to thank the Senate President and our friends in the legislature for creating, I'm just going to call it the trust fund because I always trip over the name of it, which will clearly get into the hands of our municipalities this life-saving intervention. So thank you. With that, we will be in this fight for the long haul until we can truly say we have bent the trend in opioid deaths in the Commonwealth of Massachusetts. So thank you for that.
Thank you very much, Secretary. Now at this time, I'd like to call to the podium Senate President Stan Rosenberg, who has also made combating heroin and opioid addiction and this epidemic a top priority, as evidenced by the leadership he showed a few weeks ago in working to establish this important fund that we are funding today in part through this agreement. Senate President Rosenberg.
Thank you, General. And on behalf of my colleagues, Senator Flanagan, who is not here, but chairs our own task force in the Senate, and her vice chair, John Keenan, who is, and Senator Lesser, a freshman senator whose proposal it was that the Senate put legislation forward, and we included it in the budget to create the trust fund and provide some initial funding so that we could start down the path of reducing the cost for our first responders for the use of this extremely important medication. And to you, Attorney General, thank you for taking the little seed that we planted and turn it into really a big garden, because you triple the amount of money that the legislature put on the table and brought us to close to $500,000, and that is just a phenomenal contribution. And given the numbers that you cited, it shows that we're going to be able to do a very dramatic job very quickly, and we would not have gotten that far without your help and your intervention. One of my favorite learnings as a kid was that if you lose but one child, it is as though you've lost the whole world. On the other hand, if you save but one, it is as though you've saved the whole world, because you never know what each individual life can produce in this society, in our world. And we've lost too many young people who had such great promise. And to know that we now have this medication and we'll have it more available means that we will save more lives and provide the opportunity for those young people, particularly young people, although I know it's used for people of all ages, but it's particularly tragic when young people find themselves in this situation and have lives ended far too soon, without them having had a chance to shine and see what the potential is of their own life and what they can contribute to our society. So I'm hoping that our first responders will be able to use these doses of medicine to save many young people, and I'm hoping that our system, as it continues to evolve and develop, will allow people to get the treatment they need, the aftercare, and the follow-up, so that these young people can take their place in society and life and see all the promise of what they can deliver for our society come to fruition. Thank you.
Thank you. Thank you so much, Mr. President. At this time, I'd like to call to the podium District Attorney Michael Morrissey from Norfolk County. DA Morrissey has really been on the front lines and ahead of this for a long time, including having a pharmacist on his staff, which I think says quite a bit about his leadership. So, District Attorney Morrissey, thank you very much for being with us here today.
Thank you, General. It didn't take long for me to learn in Norfolk County that in 2013, opiate overdose became the leading cause of preventable death in the county, even exceeding automobile accidents. And a little to the right, there's a graph, but as you can see, even with the good work, I'm very fortunate that I come from and live in the city of Quincy. Pat Glenn and the Quincy Police Department, Chief Keenan, had been leaders in this state and this country to put Narcan and naloxone in the hands of our public safety community, and their success was evident really quick, and it was not lost on me. And so Pat helped me organize a training in March of 2014, along with Dr. Dan Muse, the Brockton Hospital, lives in Canton, and Stoughton and Norwood Fire Department, police departments, who had assisted in the training because they thought it was very valuable. Every police and fire department in the county came to the training, and over on the right-hand side, when we had that training, and Pat Glenn is pictured in that photograph, I bought 400 or 500 doses of naloxone at that time to give to the department so they could start out at $22 a dose. And so we were able to take some drug forfeiture money and do that, but that being an up and down, it's not a good way to measure, but it was a good resource to put back in the hands, take from the drug deals and put back into the community to keep people alive. But it fast became apparent that some of the communities are going through the doses we had provide pretty quick. So they said, okay, we'll try to give them a grant of $1,000, but you had to send us your receipt. And you had to send us the receipt for what you were paying for naloxone. And had I not seen the receipts and being cheap, I would say that I saw that Walpole submitted a receipt for $37.50, and that was the end of 2014, beginning of 2015. Randolph, $39.99, and then when I saw Rentham and Needham going to $66.89, I think Plainville as well, then at that point I said, there's something wrong with this picture. Maybe it's, we're not buying it in bulk, so my friends in the Senate took care of that problem, so we now have a plan to put it in place. But naloxone or Narcan is the DuPont name, naloxone is the drug itself, has been around for 40 to 50 years. It's not a new drug. It was important to us that when we saw this, we contacted the Attorney General because of her interest, and we know as a consumer advocate that this is something that would be right up her alley, especially given her special interest. And I guess what you see is the result of her ongoing investigation and the work that she did with other departments throughout the Commonwealth that we're able to now have the settlement today. So I just wanted to say a great job, Attorney General, that I think this will be helpful to all the public safety community and to my colleagues in the Senate. Thank you for your good work, because that should keep the cost down as well.
Yeah, thank you very much. Thank you very much, Mr. District Attorney. At this time, I ask Jean Flynn to come to the podium. Jean comes to us from the Cape and knows all too well what heroin has meant to families and to lives across the state, having lost her son to this addiction. So, Jean, thank you again for being with us here this morning.
My pleasure. I'm very glad to be here, and I'm very grateful to Attorney General and all of the staff who has done everything in such a great manner to make this so much more affordable, because there obviously is a lot more need for it in the communities, unfortunately. I did have occasion to use Narcan on my own son back some years ago, and while he wasn't that fortunate this time around in May, I at least was able to see the results, that it did work well, it did work quickly, and it still gave him an opportunity to have a life. Of course, I'm so sad today that he's not here to share what it might have been for him. This disease really takes apart not only the individual but the families involved, but every life you save is the possibility of something that could turn in recovery into something of a shining star that we don't know about. There is a lot of goodness that comes out of recovery, and there is no recovery without Narcan. So I want to really appreciate everything that your office and all of your folks are doing here. Thank you very much.
Thank you, Jean.
Okay.
Thank you, Jean, and we all, I know, share in extending deepest sympathies to you and to your family and to families across the state who are dealing with this. And I know that this is a team effort, as represented by what you see up here today, when you have folks from the administration, from our office, from the legislature, and all the terrific men and women represented by cities and towns and police and fire, all in this together. This is what is needed, and this is where it's going to be going forward. So thank you, Jean, for coming here today and being part of this. At this time, I'd like to welcome our colleague, Suffolk County Sheriff Steve Tompkins, who's also been a leading advocate on this issue. Sheriff Tompkins.
Thank you, Madam Attorney General. On average, 70% of our population is involved with some sort of drug usage. 42% of our population suffers from mental illness, from the most passive to the most aggressive. And 36% of our female population are co-occurring, meaning that they have issues with drugs and mental health. And so for an initiative like this to come down the pike with all of the public safety officials and legislators involved, we at the Sheriff's Department can't thank you and everyone up here enough. To that end, when folks are, when they're sentenced to the Sheriff's Department, they go through a process called classification. When they're classified, we're able to find out all that's going on with them. And we have found that heroin, alcohol, and opiates are the main problems with a lot of these folks. And so 5 years ago, we actually began the trainer program where we teach our inmates how to use and administer Narcan. And over that last 5 years, we have trained 780 individuals. Who more should know about this other than first offenders than folks that are using drugs? Oftentimes, they are with people that are going to have an attack, and if they know how to use the kit, that really will save lives. Additionally, all of my command staff has been trained, and by the end of next year, my entire labor force, which numbers over 1,000 people, will know how to use Narcan. So I once again would like to thank you, Madam Attorney General, Senate President, D.A. Morrissey, the Baker administration and Secretary Sutters, all of the first responders, and all of the legislators and public safety officials. Thank you so much.
Yeah. Thank you very much, Sheriff. You know, several months ago, I started meeting with various firefighters and departments around the state, and it was there that we really started to hear firsthand about what was happening with some of the pricing and the price increases at a time and in the midst of people needing access to naloxone and Narcan more than ever. And I am delighted to have here today Plymouth Fire Chief Ed Bradley. Chief Bradley has been on the front lines on this issue for a long time. As we know, Plymouth and Plymouth County have been hit particularly hard by heroin and opioid abuse. And so, Chief Bradley, thank you so much for being here with us today.
Thank you, Attorney General. When the men and women of the Plymouth Fire Department came to me as a chief and said that we need to go up to the next level, we need to start carrying Narcan, naloxone, we immediately fast-tracked a training program and set out to buy Narcan. And this was before the state of Massachusetts had declared it a public emergency. So in February of 2014, I was paying $18.50 for a single dose of Narcan. Quickly, as I started replenishing that stock as we used it, it jumped up to the high 20s, mid-30s a dose. It jumped up at one point to just about $66 a dose, settled down at where we are now at $44.70 a dose. It's tough enough in a municipal budget that you're trying to put together 8 months ahead of time that's going to be good for 12 months to even guess at how many doses I may need, how many responses we may make in a year. On top of that, I had no idea how much this Narcan was going to cost me per dose. Every time I ordered it, it was jumping in price. As a result, there were other items in my budget that had to suffer because of that. And when you have to make a choice, I know that every fire chief and police chief in Massachusetts has had to make these. You have to make a choice between replacing worn fire gear or buying firefighting foam or buying Narcan. It was easy. I had to buy the Narcan. I had no choice. This agreement today is going to make it so much easier for every city and town in Massachusetts to be able to afford this without impacting their government in their own budgets, in their town taxpayers. So I thank you.
Thank you very much. Thanks so much, Chief. I also see with us here today Boston Fire Commissioner Joe Flynn and Ed Kelly from the Firefighters Association. Thank you both for being here. And finally, I'd like to call to the podium Norwood Police Chief Bill Brooks, who's no stranger to this issue. Last week, Chief Brooks and I stood to announce the legislation that would make the trafficking of fentanyl a crime, and is part of our efforts to combat this crisis. And I'm delighted to have Chief Brooks back with us here today as we announce today's agreement about the availability of Narcan. Chief.
I just want to echo what's already been said by the fire service, that this is really a momentous day for police and fire across Massachusetts, that Attorney General Healy, with assistance and support, I know, from the Senate, has worked hard to make naloxone available to first responders at a steady price across Massachusetts. We're all trying to do the right thing. We shouldn't have to worry about fluctuating price. This will be one less thing that I have to worry about. But, thinking about the issue as I was standing here and listening to the various speakers, 2 years ago, if we were standing here talking about this, you wouldn't have known what we were talking about. because police and fire have only been carrying naloxone in the field for about the last year and a half. And it was really as a result of the leadership by the Quincy Police Department that first took naloxone and put it in police cars to see how that would work, that really drove this issue forward. So I cannot say enough about them. You heard District Attorney Morrissey talk about the fact that Narcan has been around for a long time, and it has been, but it was really the development of the intranasal type that first responders could carry, that allowed fire chiefs to put it on apparatus, that allowed police chiefs to put it in radio cars, that really drove this issue ahead. Massachusetts was ahead of most other states. And, I just want to make clear that a police officer rushing to the scene of an overdose to deliver a life-saving medication at the scene of that overdose is entirely in keeping with our mission to preserve human life. And it has, in Massachusetts, quite frankly, become the rule, no longer the exception. So again, I just want to thank the Attorney General and the Senate for their hard work. Thank you.
Terrific. Thanks so much, Chief. Be happy to take any questions at this time.